10 Early Signs of Colon Cancer. Colon cancer is one of the most common types of cancer, affecting both men and women. While it often starts as small, benign clumps of cells called polyps, these can eventually develop into cancer over time. The key to successfully treating colon cancer lies in catching it early, but the challenge is that the early signs are often subtle or mistaken for less serious conditions. Understanding and recognizing these early symptoms can save lives. In this video, we'll explore the most common early signs of colon cancer, explaining what they mean and why they matter. If you notice any of these changes in your body, it's important to seek medical attention right away. 1. Changes in bowel habits. One of the earliest signs of colon cancer is a noticeable change in bowel habits. This can include persistent diarrhea or constipation that lasts for more than a few days without any clear cause. Some people may also experience a feeling of incomplete bowel movements even after going to the bathroom. This sensation, known as tenesmus, can be caused by a tumor in the colon or rectum pressing against the surrounding tissues. While everyone experiences occasional irregularities, persistent changes in bowel habits should not be ignored. 2. Blood in the stool or rectal bleeding. Blood in the stool is one of the most concerning and obvious signs of colon cancer. It can appear as bright red blood, indicating bleeding from the lower part of the colon or rectum, or it may be darker and tarry if the bleeding originates from higher up in the digestive tract. While many people associate rectal bleeding with less severe conditions like hemorrhoids, persistent or unexplained bleeding should always be evaluated by a doctor. The presence of blood in the stool, especially when accompanied by changes in bowel habits, may be an early indication of colon cancer and should not be taken lightly. 3. Unexplained fatigue or weakness. Unexplained fatigue is another subtle early symptom of colon cancer. Cancerous tumors can cause slow internal bleeding, leading to anemia, a condition where the body doesn't have enough red blood cells to carry oxygen. Over time, this can result in feelings of constant tiredness, weakness, or shortness of breath, even with minimal physical activity. If you find yourself feeling fatigued without a clear reason, such as a change in sleep or stress levels, and you are experiencing other symptoms, it could be a sign of something more serious. Chronic fatigue, especially when unexplained, should be discussed with a healthcare provider. 4. Unexplained weight loss. Sudden and unexplained weight loss can also be an early warning sign of colon cancer. When the body is fighting off cancer, it uses up extra energy, causing weight loss without changes in diet or exercise. Additionally, tumors can interfere with the body's ability to absorb nutrients, further contributing to rapid weight loss. If you find yourself losing more than 10 pounds in a short period of time without trying, it's essential to speak with your doctor. Weight loss, combined with other symptoms like changes in bowel habits or abdominal discomfort, can point to colon cancer. 5. Abdominal discomfort or pain. Persistent abdominal discomfort, such as cramping, bloating, or pain, is another symptom that may indicate colon cancer. As tumors grow, they can cause blockages in the colon, leading to sharp or chronic pain. Some individuals also report a constant feeling of fullness or bloating, even after small meals. While occasional abdominal pain is common and usually not a cause for concern, consistent discomfort, especially when combined with other symptoms, should prompt further investigation. 6. Weakness or shortness of breath. Anemia caused by slow blood loss can lead to feelings of weakness and shortness of breath, even during simple activities. As mentioned, when colon cancer causes internal bleeding, the loss of blood over time reduces the body's ability to transport oxygen, making everyday tasks feel more exhausting than usual. If you notice that you're becoming short of breath more easily or feeling unusually weak, it could be a sign of anemia, which may be linked to colon cancer. It's important to seek medical attention if this symptom persists. 7. Narrow or ribbon-like stools. A change in stool shape, particularly if they become narrower or more ribbon-like, can be another early sign of colon cancer. Tumors in the colon can partially obstruct the passage of stool, resulting in thinner stools. While this symptom alone isn't definitive, it can be a clue when it occurs alongside other signs such as rectal bleeding or abdominal pain. If you experience consistent changes in the size or shape of your stool, a doctor should evaluate the potential causes. 8. Feeling of urgency to have a bowel movement without result. Colon cancer can also cause a persistent feeling of urgency to have a bowel movement, even when there's little to no stool to pass. This sensation, similar to tenesmus, occurs when a tumor in the colon or rectum presses on the digestive tract, creating the impression that you need to use the bathroom, but without any significant result. This symptom, if persistent, should not be ignored, especially if it's accompanied by other gastrointestinal symptoms. 9. Persistent gas or indigestion. Indigestion, bloating, or excessive gas that doesn't go away with over-the-counter treatments can also be an early warning sign of colon cancer. Tumors in the colon can block the normal passage of food and gas, leading to a buildup that causes discomfort. While gas and indigestion are common and can often be attributed to diet, their persistence should be cause for concern, particularly if they occur with other symptoms such as weight loss or changes in bowel habits. In conclusion, colon cancer can be a silent disease, with symptoms that are easy to overlook or mistake for less serious conditions. However, by paying attention to subtle changes in your body, you can detect early signs before the cancer progresses. Persistent changes in bowel habits, blood in the stool, unexplained fatigue, or weight loss are all warning signs that should not be ignored. So, if you notice any of these symptoms, it's important to see your doctor as soon as possible. Early detection of colon cancer is key to successful treatment, so don't hesitate to seek medical advice if you notice anything unusual. Taking action early can make all the difference in catching the disease in its most treatable stages. Thank you for staying with us until the end. If you enjoyed this video, don't forget to like, share, and subscribe to stay updated with the latest insights on health and nutrition.